Honorable Minister of Health, Dr. Frank Anthony.
Thank you very much, Madam Speaker, honorable members. I want to first start by thanking Dr. Singh and his team for the budget 2024. The budget is not just a financial document. It is a roadmap that outlines the PPPC government's priorities, commitments, and strategy for the fiscal year. It reflects our collective aspirations and concrete steps we intend to take to achieve them. The PPP civic government has presented a budget that focuses on ensuring continuous economic growth, social development, and the welfare of every citizen of Guyana. Undoubtedly, the budget will prioritize the people and create opportunities, bringing in a new era of prosperity for the Guyanese people. It is no surprise that the theme of this budget is staying the course, building prosperity for all. Madam Speaker, as we continue to strive towards prosperity for all, there are individuals who are attempting to disrupt our progress. In recent days, we have listened to their arguments and have seen their best attempts to dissuade us. They have boldly and sometimes barefacedly manipulated facts to fit their fictional beliefs. But let me be abundantly clear. None of these fake postures will exonerate them from the fraud and electoral rigging that they attempted. None of these fake postures will exonerate them from their atrocities against the sugar workers and other working people of this country. None of these fake postures will exonerate them from their racist advocacy. None of these fake postures will undo what they have done to the Guyanese people. Madam Speaker, I want to say to them that we remember you for who you are. Yesterday leaders with yesterday thinking, unprepared, unfit for the 21st century Guyana. Madam Speaker, yesterday the Honorable Viceroy Jordan suggested that I should follow the APNU AFC example and provide a river ambulance for the people of Moroccobai. Well, first of all, I want to say to him that the people of Moroccobai, they actually have a river ambulance. But he went on in his presentation, he cited what the coalition did for the people of Baracara. I want to thank the honorable member for this emblematic example of the APNU AFC stewardship of the health sector. Madam Speaker, on the day that the boat was commissioned and launched into the river, it never made it to Baracara, I'm told. It broke down midstream and had to be towed back to the landing, where it was left abandoned. It was left abandoned. It was left abandoned. Look, another example. And Madam Speaker, I'll happily turn this over so that they can have an example of the ambulance that the honorable member is recommending to me.
That they are so proud of.
Very proud.
That they are so proud of. I wonder who they bought it from. This is part of the fight.
Madam Speaker,
Oh yeah, the fight peace program.
if you are unable to launch a boat, what makes you think that you can manage a $1 trillion economy?
They can't conceive it.
I think that we are all familiar with the spectacular failures of the APNU AFC.
Oh, remind them. Remind us.
The Durban Park eyesore, the Bottom House drug ban, the chronic drug shortages that we experience.
10 billion we have to get rid of.
And I just heard the Honorable Member Dr. Karen Cummins praising the Ocean View Infectious Hospital.
Oh boy.
You should not be praising that. It was actually the Ocean View scandal. Because when we came in, that place, which was open about 2 or 3 times by the then president and the then ministers, when we actually went there, it was a shell. Not a single bed. Nothing was functioning. They didn't have electricity. They didn't have a sewage system that was functioning. The water was not there. I remember calling the Honorable Colin Crowell to come and assist me in getting water into that place. I remember talking to the Minister Indar to help us to get electricity in the place. Not a single bed. And this was the infectious hospital that was supposed to save COVID patients. Not only did they not have the infrastructure in place, they did not have a single staff member that was there. And when we were told that they had bought ventilators, there were supposed to be 20 ventilators that was working in the place. And when I visited, not a single ventilator was working. And first of all, it was not even a proper ventilator. It was something that should be used on ambulances to give people some air.
I wonder who they buy that from.
And when we went there, none of the piece of equipment had any battery in it, so it could not work. This was what we inherited. And this honorable member came here to glorify what as their legacy. But, Mr. Speaker, this is emblematic of their management of COVID-19. And I can go on because I remember when we just came to government in August, we were told that they were only giving 5 COVID tests per region so that you can test people. Obviously, that was inadequate, so we did not even know how many cases we had. And all of that we had to fix, and of course the result had to go to the minister before it was released to the doctors.
Tell them how to close off the border, tell them. Close off the border, tell them.
Mr. Speaker, This is just a small part of the legacy of these political aspirants for power in 2025.
These are election riggers. These are election well done, sir. Well done.
Who in their right mind in this country would want to be saddled with this lot ever again? Who in their right mind?
Never again. That's why the people said never again. We come to wrong from John people.
Mr. Speaker, when you compare what they did to what we are doing now, there's a total difference. We are on the verge of a healthcare revolution driven by strategic initiatives, innovation, and a collective commitment to the well-being of the citizens of this country. This level of transformation is unparalleled in the history of Guyana. Our objective is not only to build good health care, but as mandated by the President, we must strive to create a world-class healthcare system. This budget is not about empty talk. It is a budget that transforms talk into action. This budget will revolutionize every sector and uplift the entire nation. It is a budget all about the people of this country, their health, their well-being, and their prosperity. Mr. Speaker, I have heard repeated lamentations that this budget has nothing for the people of this country. And I want to debunk that notion. This budget has something for everyone. But I would like to highlight a few examples so that the people of this country can understand the goodies that are contained in this budget. Mr. Speaker, let's look at our children. What does this budget have for the children of Guyana from birth to school age? Let's start with the youngest, our babies. How do we protect our neonates? That is the first 7 days of life. We need specialized neonatal units so that we can give them the care that they need. Mr. Speaker, most of these units are in the Georgetown Public Hospital, and a few are in some of our regional hospitals. But this government, we decided that we want to expand neonatal care to all our regional hospitals. And starting from last year, we expanded neonatal care at New Amsterdam, West Demerara, Public Hospital Sudi, Linden Hospital Complex, Mabaruma, Kumaka, Bartica, and the Lethem Hospital. And this year, we will do another 6 set of neonatal units in the new 6 hospitals that we are building. These facilities would significantly improve the chances of survival for babies who are at high risk of premature death. Mr. Speaker, this is what we call transformation in action. Mr. Speaker, immunization is a highly effective healthcare intervention, and it prevents the spread of infectious diseases. Our childhood immunization program has been successful in protecting our children against 19 different diseases. Mr. Speaker, last year, the vaccination coverage ranges from 98 to 100%. And this is one of the best coverage rates in the entire Caribbean. And Mr. Speaker, as part of our plan to prevent cancer in children and cancer in adults, we aim to increase HPV vaccine coverage for children 9 to 15 years of age. And we would like to increase this coverage to 90%. And if we are able to accomplish this, then future generations of Guyanese will be HPV-free in terms of the cancers that they produce, including cervical cancer. Mr. Speaker, this is transformation in action. Mr. Speaker, in 2023, the PPPC government started a school health program in collaboration with a global leader like Mount Sinai. Last year, we did preventative checkups. And when I said preventative checkups, we were able to screen children to check to see whether they're seeing properly, they're hearing. We look at their mouth to check, see if they have any rotten tooth. And we did a general checkup for 12,000 children in this country. And when we did that, we discovered that close to 1,500 of them, they had varying problems. And we were able to bring them into the health sector and treat them so as to prevent further deterioration. This is what caring government looks like. But we didn't stop there, Mr. Speaker. In this year's budget, we are going to ensure that we continue this program at the nursery level, but we are also going to extend it to primary schools so that every primary school child can benefit from screening. And furthermore, it is our government's intention that every school-age child would be screened at least once in nursery, once in primary, and once in secondary, meaning that they'll get free screening during their school life. And any problem that we find, we will be able to fix it so that these children can grow up healthy. This, Mr. Speaker, is transformation in action. Mr. Speaker, promoting eye care for children is crucial for the overall well-being and education success and future prospects of these children. The PPP, this year the PPPC government will launch a special eye care program for children and the elderly. For the children, we hope to detect conditions such as amyloidea, which means lazy eye, strabismus, which means cross eye, and those with refractive errors, such as those with nearsightedness or farsightedness or astigmatism. Well, those over there, bad eye, the budget. And with prompt intervention, we can prevent long-term vision impairment, which may adversely affect children's academic performances and life opportunities. Mr. Speaker, I want to encourage every parent to take this opportunity to ensure that their child's vision is checked. And I also want to encourage the elderly to make sure that they get these vouchers so that they can go and do eye checkups. And for the elderly, if when we check and you have cataracts, then we will be able to fix those cataracts for you so that you don't have to live life where you're not seeing properly. And as I'm on that, Mr. Speaker, I want to tell you that when we came into government, that the Port Morant Hospital, where we were doing a lot of eye surgeries, that none of the microscopes were working. And I heard a faint echo in the corner there, but this is another lie. It is not a lie, because
You've been wrong long enough about parliamentary words.
I heard an echo of someone claiming that they probably left the ophthalmology center at Port Morant in good condition.
It was closed and not working.
It was closed. None of the microscopes were working. The theater had mold, and we had to spend millions of dollars to fix it. And today, I am proud to say that we are able to send ophthalmologists to the various regions of our country so that they can screen the population there to see whether or not they have cataract. And if they have cataract, we put them on a list. We fly them out. We bring them to Port Morant. We operate on them, make sure they're seeing properly, and then we take them back home. And hundreds of Guyanese citizens have benefited from this program. Mr. Speaker, what about women's health? Women's health is of utmost importance, and cancer among women is a major concern. Breast cancer, cervical cancer are the most prevalent cancers among women. And we want to make sure that we can prevent this in the first instance, and if not, we must be able to detect it and then treat these diseases. Mr. Speaker, the PPP government has set a goal to meet the World Health Organization's target by 2030 regarding cervical cancer. The goal includes the following targets. 90% of our girls should receive full HPV vaccine by the time they reach 15 years of age. The next target is 70% of our women should undergo a high-performance screening test by the time they reach 35, and again by 45 years of age. And the third target is that 90% of individuals who are diagnosed with cervical cancer should receive appropriate treatment. For the first goal, Mr. Speaker, this year we will target 41,539 girls between the ages of 9 and 15 to ensure that they can get the HPV vaccine. And if we accomplish that, then we would accomplish the 90% that we are going after. We will also not stop there, because the latest guidelines from the US CDC and from the WHO states that persons older than 15 can also be vaccinated with the HPV vaccine. And so, between 16 and 25, we want to offer those women 2 doses of HPV, and we would be targeting 62,500 women in this age category. And for those who are older, between 26 and 45, where we estimate that there are about 94,000 women, we want to offer them 3 doses of this vaccine so that we can prevent cervical cancer. Mr. Speaker, to meet the second goal of where we want to ensure that 70% of our women aged 30 and between 30 and 45 with high performance tests, this budget has allocated enough resources so that 52,000 women can benefit from VIA, from pap smears, and from HPV tests. And this is one of the special measures that Dr. Ashley Singh spoke about. Mr. Speaker, in addition to all of this, if a woman is diagnosed with cancer during this screening process, we will provide a range of treatment options depending on the stage of the cancer. Treatment options range from cryotherapy to surgery, and we will be working to ensure that we can introduce brachytherapy services in Guyana. Right now, when people need brachytherapy, they have to go abroad for those services, and we will be bringing that to Guyana. Mr. Speaker, we are very confident that with these measures, or a combination of these measures, vaccination, testing, and treatment, that we'll be certain that we'll be able to reduce cervical cancer in Guyana. Mr. Speaker, this budget also provides for us to be able to provide more mammograms so that those persons who want to screen to see whether or not they have breast cancer would be able to do so. And during this year, we would like to introduce 3 more mammogram machines to Guyana. One would be at New Amsterdam, one would be at Linden, and another one would be at West Demerara. In addition to all of this, Mr. Speaker, we would also be offering family planning assistance to more than 16,000 women across this country. And for women who need care packages, pregnant women who need care packages, we have budgeted to provide care packages for at least 3,000 women who need them. Mr. Speaker, this is just about some examples of how women would benefit from this budget. In terms of chronic non-communicable diseases, the last government, they had no program to address chronic non-communicable diseases. In fact, in 2021, when we came back to government, we established a special program to deal with chronic non-communicable diseases. And you can check the budget because it's a program now in the budget. Mr. Speaker, I want to highlight a few things that we are doing under this program. I want to touch a little bit on diabetes, hypertension, and cardiovascular diseases. Mr. Speaker, for diabetes, the International Diabetic Federation estimate that we probably have close to 60,000 persons who are affected by diabetes. One of the first things that we did was to ensure that we developed new guidelines to manage diabetes. And we did this with expert consultation from consultants from Mount Sinai. And so we now have new diabetes guidelines. And to improve how we manage people, one of the things that we did is to move away from using glucometers to using HbA1c as the gold standard for testing. And in this way, because this is relatively new, although it has been around in the world for a long time. This is relatively new to Guyana. And in preparing for these new guidelines, last year we purchased more than 40 different HbA1c machines and distribute them to every single region in Guyana so that people can have access to this testing. Yesterday, in one of the presentations, the Honorable Member Beverly Alert said that at West Demerara we don't have glucometer strips. And I called the RHO to find out whether this is accurate or not. And I can say to the Honorable Member that we have an abundance of testing strips. And anybody who needs to be tested can go there and get tested. But in addition to that, we also have 2 HbA1c machines where people can be tested for diabetes. But we did not stop there, Mr. Speaker. If we are going to manage and get better control of patients' glucose, we also need to update the medication options. And since last year, we have changed out a lot of the medication, and we are using new medication for our diabetics. And in this year's budget, the minister has adequately provided for us to buy more new medication so that we can effectively control diabetes in Guyana.
Thank you, Honorable Minister. To hear more about this, you'll need an extension.
Mr. Speaker, I move that the honourable member, I'm tempted, Mr. Speaker, to volunteer 30 minutes of my own time to the honourable member. But were you not so inclined, sir, I move the honourable minister be given 5 minutes to conclude his presentation.
Thank you, Minister Singh. Honorable Minister Anthony, you may continue to conclude.
Thank you. Thank you very much, Mr. Speaker. There are quite a lot of things I want to say, so I'll try to wrap up in this last couple of minutes. Mr. Speaker, in this budget, this government has set aside monies to make sure that we can improve the infrastructure of the healthcare system in Guyana. We have budgeted 13 new hospitals. So we have 6 right now that are under construction, 8 in fact under construction, and we have Bartica that would be coming on stream. And I want to say to the honorable member who spoke before me, that under the APNU, they went to India and got a loan. And it was supposed to be for West Demerara, Sodi, and Bartica. And when we came in, nothing was done. When we came in and we went out, we recognized that from the design, when we did the design, that the money would not be enough to do all 3 hospitals. And so we have decided that we are going to spend the money on fixing Bartica Hospital. In addition to Bartica, we will be doing the hospital at Letem, Maruka, Camarang, and Keto. And this would change the infrastructure landscape for our hospitals in this country. Mr. Speaker, we have also been using technology. And with the technology, we have started telemedicine. Right now, we have 25 telehealth centers in this country, and we'll be adding from this budget another 25. And some of the things that we're doing in telemedicine are truly revolutionary. In the next week, the President would be opening a telepathology center, the first in this region, where we'll be able to take samples here, take high-resolution image, and send it abroad so that we can have a diagnosis done abroad. Mr. Speaker, quite a number of things were raised by the last speaker, one of which was nursing and nursing training. And I want to say to the honorable member that migration of nurses is a global phenomenon. It's not only confined to Guyana. But what is important is what we do. And the capacity to train nurses in this country with the 3 nursing schools was about 200 nurses per year. Last year, we started a program where we have 1,200 persons who are right now doing nursing. This year, we are taking in another 1,200. Next year, we'll take in another 1,200. The year after that, we'll take in another 1,200. And we will employ every single one of them. Next month, Mr. Speaker, we will also be taking in 1,000 people to do the nursing assistant program. And next year, we'll take some more. And the year after that, we'll take some more. And while we take in those persons, let me explain the payment to you. Let me explain payment to you. Under APNU AFC, from 2016 to 2020, the percentage change for a staff nurse was 35%. Under this government, from 2020 to 2023, the percentage change in their salary was 71%. For a staff nurse midwife, your change for the 5 years, 15%. And this government gave them 91% more on their salary. That is the change. That is the change. So, Mr. Speaker, there are lots of things that we can say. Lots of things. And we have lots more. But, like you said, and like many of the members over there have said, you are not supporting the budget. But whether you support or not, we are going to pass the budget so that the people of this country can benefit from all the good things that we have in store for them. I thank you very much, Mr. Speaker.
Thank you very much, Honorable Member Dr. Anthony. Honorable members, before we suspend for lunch, as soon as we return from lunch, the speaker will be the Honorable Minister of Public Works, Bishop Juan Echille. This is a good time to take the suspension.